Hi everyone, welcome back to the OT Meeting Room. I'm your host, Debra Battistella. This is the place for occupational therapy practitioners who want to make OT the most requested therapy. Keep in mind that information is provided for educational purposes only. It's not provided as a professional service, medical intervention. It's not supposed to be a substitute for formal education, diagnosis, or treatment. Today's topic is frequently asked questions about using mirror therapy for upper extremity function following stroke. Let's dive right into question number 1. My client had a stroke that affected their dominant arm and hand. Does this disqualify them from participating in mirror therapy? The answer to this question is no. Handedness does not affect your ability to use mirror therapy with your client. I want to encourage you to not confuse a teaching strategy with actual intervention use. Sometimes when instructors are educating someone on an intervention to use with a stroke survivor, we often will simulate a stroke by having you, the participant, the learner, simulate having a stroke by using your non-dominant hand to practice participating in the intervention. So handedness doesn't matter. It doesn't really have anything to do at all with using mirror therapy as an intervention with your client. Question number 2. I am an occupational therapy practitioner. Do I need to have a certification to use mirror therapy? The answer is no. You do not need a certification in mirror therapy to use this modality. In fact, there is no certification for mirror therapy. Now, you may have a certain certification like a stroke recovery specialist certification or perhaps a certification in geriatric interventions where you may have learned about this intervention and other interventions that are appropriate for use with a stroke survivor or an older person. These types of certifications are different from your basic understanding how mirror therapy works and how to use it with a client. Okay, question number 3. Please help me understand why I don't need a certification to use mirror therapy for my clients. I love this question. The reason why you don't need a certification to use mirror therapy has to do with what your education entailed to achieve degree requirements and the credentials that you were granted by completing your program and passing a certification exam and completing the requirements required for credentialing. So if you're an occupational therapist or an occupational therapy assistant, a physical therapist or a physical therapist assistant, maybe a chiropractor or other type of healthcare provider, part of your degree requirements entail human anatomy and physiology, specific education around the nervous system function, and then various rehab strategies. Now, I am an educator. I used to be an educator in an occupational therapy assistant program, and we taught a lot about different interventions, specifically interventions that are appropriate and effective for use with stroke survivors, and mirror therapy was one such intervention. So having that basic understanding and knowledge of the human body and the nervous system and recovery potentials, recovery strategies, all of that information is your certification, if you will, for using different treatment modalities. Now, this is going to take us into the next question. What is my professional responsibility when using mirror therapy? Well, it ties into what I was just talking about we have a professional responsibility that is something that we need to apply with every intervention that we use in our practice with clients. It's essential that we have an understanding of the client's diagnosis, the rehab principles around that diagnosis, the intervention that we're selecting to use to help them recover function, and also understanding the client. Because while an intervention may be appropriate for a particular diagnosis and the deficits that you're seeing in your client, doesn't necessarily mean that the client is a good fit for the intervention. And this is where clinical reasoning comes into play. We have to really use our critical thinking skills and clinical reasoning in choosing an intervention. Because like with mirror therapy and other interventions, there may be some potential adverse reactions that can occur through its use, and we need to understand what those are, because we don't want to cause harm or more harm than what a person has already experienced. So it's really important for us to be able to use that type of thinking and understanding, and we have a responsibility to learn about an intervention if we're going to use an intervention. So if we don't have a full understanding, it's up to us to maybe take a continuing education course or receive some mentorship from someone who does understand it before we start using it with a patient or a client. The other thing I want to bring out is, other point I want to make, if you will, is Know Your Practice Act. It's important to know the guidelines and regulations around where you practice. So in the United States, we have state practice acts. And so if you're not in the United States, you're in another country, please refer to those guidelines that guide your practice. And all of this goes along with all of our professional responsibilities in being a responsible and effective clinician. Let's wrap up this video by talking about a few additional topics. First, what mirror therapy is. Mirror therapy is an evidence-based intervention appropriate for use with stroke survivors, people who have phantom limb pain resulting from an amputation, or someone who has complex regional pain syndrome. Understand that mirror therapy is a brain priming modality. Now, what to do if your client thinks it's boring? Well, first of all, my impression is that more education is needed. And in terms of that education, it will begin with you, the provider, and then with the way that you present it to your client. I personally have never had a client tell me that they think mirror therapy is boring. In fact, I have used this intervention with someone in their 90s, and their first response was, wow, this is really cool. So if you educate yourself and have a full understanding of the intervention, and you realize that it is an intervention that has high evidence, like good, solid evidence behind it, and that people in studies who use mirror therapy along with traditional rehab, they tend to have better outcomes. It's my sense that you will have a better understanding. You'll understand how it works on a person in the brain. A lot of, it's very cerebral. So I think if you understand what it is and are better able to explain it to your clients, then they may be more receptive to trying this strategy. So what are barriers to implementation? Well, if you go back to the first video in this series, I talk about an article that discusses reasons why evidence-based interventions are not implemented in clinical scenarios. One of those reasons, it has to do with practitioner belief and buy-in, which I think comes along with what I was just talking about, like educating yourself and having an understanding on mirror therapy, how it works, and when and how to use it will help with that. The clinical culture where you practice has a lot to do with introducing new types of interventions. Now keep in mind, mirror therapy is not a new intervention. It has been around for quite a while. But bringing in something new that's not typically being done, if you have a culture of reception, receptivity, and curiosity, it's going to be a lot easier to introduce something new than if you're working in a practice culture that is more critical of others and of people who are willing to try new things. And lastly, it has to do with the leadership team. You need leadership who is supportive of you bringing in evidence-based interventions and providing therapists with the space and time to learn about these, to practice using them, so that they build up their confidence when using them with clients. One strategy that is effective is becoming a champion. So if somebody in the clinic is willing to become a mirror therapy champion, learn about it, and then introduce it to others and help others get going with it, that can be real helpful for using a new intervention in your clinic and adding this modality to your repertoire. That wraps up, like I was saying, this wraps up this talk. Stay tuned for part 4, where I talk about some of the science behind mirror therapy. And if you're curious about more information about stroke, head over to the Noggins and Neurons Brain Injury Recovery Simplified podcast, where I join my co-host, Dora Zuliger, and we talk all things brain injury recovery simplified. We have some pretty interesting guests on the show as well. If you're wanting to learn more about mirror therapy, I do have the OT's Guide to Mirror Therapy, a full program designed for you, the practitioner, to use with your clients. There are some videos in there where I explain mirror therapy to you, the practitioner, and then I explain it also in different terms to your clients. So you don't have to do all the education on your own. Also, if you're interested in consultation and mentorship, feel free to reach out to me at info@creativeconceptsot.com. I love hanging out with other practitioners and talking about ways that we can improve the way we deliver our occupational therapy services. All right, thanks for being here. Make it a great day.